Greetings on behalf of the LSU Student Health Center. My name is Emily, and I will be reviewing valuable information about how we can work together to protect ourselves and others from COVID-19 because tigers do their part. LSU Interim President Tom Galligan is leading us through this difficult phase in history, and in his own words states, "The tiger spirit is unlike any other, and I know you will all continue to rise to this occasion and find ways to show the world that LSU is resilient and fierce. The health of our community is of the utmost importance and will be at the heart of all decisions we make regarding the return to campus." In this presentation, we'll be discussing how infectious diseases spread, how to be vigilant in the age of COVID-19, and several helpful, reliable resources. I emphasize the word reliable. There's an extraordinary amount of information on the internet and social media. As a consumer of information, it's incredibly easy to get confused by the amount of conflicting information we read and see. Remember to focus on reliable resources. Science is an ever-changing field of information. As more is discovered about COVID-19, and really any topic, guidance and recommendations could shift and change due to more current research being available, which can simply mean more up-to-date protocols. Also, it's imperative to note the information in this presentation is not intended to take the place of medical advice. Consult your healthcare provider for individual guidance. So here we have a few ways infectious diseases in general can spread. And we'll watch a couple of videos on the subsequent slides to further explain the spread as it relates to COVID specifically. Spread can happen via direct contact with others, through droplet spread when we talk, sneeze, cough, or sing. Airborne spread is when infectious agents are carried by dust and small droplets that are suspended in the air. Through vaping, e-cigs, and juuling, which can intensify the potential of virus lingering in the air. Surfaces called fomites, which are objects like door handles, elevator buttons, counters, and things like that. And devices like phones, tablets, laptops, computers. Those are another example of popular fomites. This video will give us a better understanding of how COVID can transmit through the air.
I'm Joel Baines. I am the Dean of the School of Veterinary Medicine, and I have a PhD in coronaviruses. The way this virus essentially transmits is the large droplets. That's why CDC recommends this 6-foot or greater distance. So distancing has a great effect on how those droplets actually move in the air. So most of them drop down and hit the floor within 6 feet. There's this aerosol, which are tinier droplets, and they can remain suspended in the air, but there's really very little evidence that those are the major way, say in a normal conversation, that transmits from person to person. There is no evidence that the virus actually can go from room to room and remain infectious through an air conditioning system. It's big droplets which carry lots of virus and get to people immediately. Masks, very simply, worn consistently, are the best way to go.
In this video, we'll provide some insight into how smoking, vaping, etc. can play a role in the spread of COVID and increase risk for those who do.
Think about the other people around you. Many people have just come to campus for the first time. You're going to be living with a variety of people and a variety of circumstances, and a lot of your behaviors may have an impact on other people's health and welfare.
Of course, to smoke or to vape, you basically have to take your mask off. You are now potentially spewing droplets out into the atmosphere, which is exactly what we don't want to do, because the droplets are the key to the spread of this virus from person to person.
During this pandemic, some data have shown that if you're a young adult even, and you vape, you are 5 times more likely to have a diagnostic of COVID-19.
Long-term smokers do seem to have a higher risk of more severe effects from COVID-19. So instead of brushing it off with a mild respiratory infection, chances are higher that they will actually have much more severe infections and end up on a ventilator. Again, it's early days, but that seems to be the trend right now.
Obviously, if there is an opportunity for cessation, that would be something that would probably be a good timing during this pandemic.
We will be covering 3 key concepts to keep in mind during this pandemic: preventative measures, steps for self-monitoring, and assessing our environment, not only on an individual level, but also in our surrounding communities. By now, we have all heard about the preventative measures to mitigate the spread of COVID. Covering coughs and sneezes, we should all have hand washing down pat. Face coverings are mandated in the state of Louisiana and required on campus. Disinfecting items and surfaces. And please, please, if you start feeling bad and have COVID symptoms, do not risk exposing others. Stay home and reach out for help. We've all heard the importance of wearing a mask and face coverings. However, to be effective, we also need to wear and care for them appropriately. Let's take a look at this video for more guidance.
Hi everyone, I'm Janelle, psychiatric nurse practitioner in the Student Health Center. Do you know about the face covering requirements and how to wear and clean it? According to the Return to Campus Roadmap, face covering use is required on campus and public spaces, especially when it is not possible to maintain physical distancing of at least 6 feet. This includes while entering and exiting campus buildings, moving through hallways and stairwells, and when in common rooms, such as classrooms, elevators, and other frequently shared spaces. In this video, we will discuss why face coverings are required, different types of face coverings, how to properly put on and remove face coverings, and care for them. Types of face coverings. You may have heard various terms used to describe face coverings. Surgical mask and N95 respirator mask are specialized coverings that should be reserved for healthcare workers. For your purposes, we're anticipating utilization of cloth coverings. Although many cloth masks look similar, they may have slight differences, including filters that can be inserted into the mask, or a nasal bridge clamp, which helps to secure the mask to your face and often prevents moisture from accumulating on glasses. Putting on face coverings. First, wash your hands. This is best done utilizing soap and water, creating a lather, and washing for at least 20 seconds. Sing "Hey Fightin' Tigers" while you wash. Then, place the mask on your face, ensuring that it is covering your nose and mouth. Your mask should fit securely against the sides of your face and under your chin. Most importantly, make sure you can breathe easily. Prior to removing the face mask, it is important to note that the exterior of the mask is considered possibly contaminated, as it has prevented environmental factors from making contact with you. Therefore, once home, your face covering should be removed with this caution in mind. Removing face coverings. You should only make contact with the strings, loops, or material near your ears. Once removed from your face, fold the outside corners together, theoretically enclosing the contaminated material toward the inside. And now it's ready for the wash. Finally, wash your hands immediately after removing your mask. As you can see, the role of face coverings are vital in our attempt to keep our community safe. It is also important to know that anyone who has trouble breathing or is unable to remove the mask without assistance should talk to healthcare professionals before utilizing a mask. Please be reminded that if you are sick with COVID-19 or think you might have COVID-19, do not visit public areas. Other than seeking medical care, you should remain home. It is our responsibility as part of the LSU family to learn how to wear and remove face coverings correctly, as well as be sure to wash cloth masks daily. Stay tuned for more Tiger tips, and remember, we're here to help you keep roaring.
Having multiple face coverings helps us to keep up with the washing cycle. Consider keeping one at home, maybe in your car, backpack, or bag to ensure you always have one handy. And you can also visit this CDC link for more info about wearing face coverings and additional guidelines. This visual helps us understand how these measures can reduce risk, especially since we know there are individuals who have COVID but don't have symptoms and therefore are not aware they are infectious. Of course, the least amount of risk for transmitting or contracting COVID is by staying home. But even when an infected individual and uninfected person both wear masks or face coverings, transmission can remain low. However, when an infected individual is not wearing a mask, even if the uninfected person is, the transmission of COVID can be high, which is why it is so important for everyone who is able to wear face coverings to do so. We all hope to stay healthy, but we should all have a solid plan in place in case it's needed. Create emergency lists to help yourself and those around you to be able to notify contacts if needed. If possible, identify a space that can be used to separate yourself or someone who has symptoms. And in case we do fall ill, it's wise to already have some supplies like medications, face coverings, and cleaning supplies. To help us be prepared, this video can help us learn how to create our own health toolkit.
Do you know what healthcare items you should bring when moving onto campus or to an apartment nearby? Hi guys, my name is Charlotte Jackson and I'm a registered nurse at the Student Health Center. Today I will be reviewing a list of helpful items that you should include in your Tiger Health Kit for your living space. First, you want to find a box, a shoebox or a container, something to keep all your items in a single location. Now let's walk through some of the things you want to put in there. Some essential items would include a fever reducer, such as acetaminophen, ibuprofen, or naproxen. Also, a thermometer, some bug spray, some sunscreen, and some Band-Aids. It will be a good idea to also include a multivitamin, an over-the-counter antihistamine, such as Claritin or Benadryl, antacids, an over-the-counter cough and cold medicine, some hydrocortisone cream, and a triple antibiotic cream. Finally, these last few items are key to your return to campus and staying healthy. Face mask, hand sanitizer, and a surface disinfectant wipe. Stay tuned to the Tiger Tips series for our video on how to properly wear a face cover.
LSU students, faculty, and staff are required to use the LSU Tiger Check program. We're all being asked to monitor ourselves by using this tool daily. Tiger Check will help us to monitor how we're feeling and to remind us of important safety procedures. Here are some of the more common symptoms of COVID-19. It's very important to realize that some people do not exhibit any symptoms, so they're considered asymptomatic. However, this person can still spread the virus to others. The range of symptoms greatly varies from mild to severe and can take anywhere from 2 to 14 days to show up after an exposure to COVID. So what should we do if we're feeling sick or experiencing COVID symptoms, or really if we're just unsure? First, stay home, avoid close contact with others, isolate from others in your living space if possible. Call your doctor. You may have to leave a message for them or their nurse. Stay home until you hear back. Explain your symptoms and follow their recommendations. They will guide you on next steps. In this video, Dr. Catherine O'Neill explains how contact tracing can reduce the spread of COVID.
What you're looking for when you think about how will I know if I have coronavirus? I'm a young person, I might have mild symptoms. You're looking for something out of the ordinary. With any of those subtle symptoms, just go get a test. Call Student Health. Where do I get a test? We would rather be certain than have you wonder for 72 hours before you finally feel sick enough to get one and have infected all of those people. Anytime you feel short of breath, anytime you have chest pain, anytime you have very high fever and you start to feel like you can't get it down, you should seek medical care. Contact tracing helps because those people who you came into contact with that day have a whole 14 days that they may begin to show symptoms and their viral load may go up. That's a really long time. And so it's so important to tell them, hey, you've been in close contact. Hey, you have to modify your behavior. Because if they do, they may cut the people that they infect down to 0. And so the transmission stops. If you don't have that close contact tracing, they go on to spread it to 2 to 3 more people. And so the best thing to do is be aware of when you've been a close contact, modify your behavior, stay away from people a little bit more, get through your 14 days, and continue to experience college the way we wanted to.
There are several options for testing. LSU students can contact the Student Health Center if they have symptoms of COVID, where testing is available on location if recommended by a clinician, and the provider will explain the process. For updates about campus testing sites, you can visit the LSU Roadmap website listed here. Your personal community healthcare provider can also guide you on where to get tested if needed. In addition, you can refer to this website from the Louisiana Department of Health for up-to-date info about free testing sites throughout the state of Louisiana. Although TigerCheck has information if you indicate a COVID positive test or possible exposure, these resources can provide additional understanding for some important key terms. So I'm going to navigate to this first site here. I would like to point out some of the helpful terms and procedures that they point out here. So if you're symptomatic and test positive for COVID, there are some of the guidelines here, as well as if you're asymptomatic and test positive. Also guidelines if you're a close contact, what to do in terms of quarantining, and also defining what a close contact is. So greater than 15 minutes spent with someone within 6 feet of them that is a COVID positive exposure. Also down here, frequently asked questions. There's a lot of good information that can clear up some confusion. And then this next site, this CDC link, is a good resource for a visual calendar of how to count your quarantine or isolation days if you're instructed to do so. So it's really just a helpful tool to get a visual and understanding. There's some pretty straightforward examples here, but there are also some slightly more complicated scenarios. So I find that helpful in just having a better understanding of what the guidelines are for quarantining or isolating. And of course, you should always consult with your healthcare provider for clarity because there's so many variables to consider. It's hard not gathering with groups of friends or family or going places where risks are higher. We can do our part to make informed decisions by taking a little time to assess the risk of our activities. Questions to ask ourselves: am I in an at-risk group? Do I live with someone at risk? Am I visiting at-risk groups? If the answer is yes to any of these questions, we really need to identify if certain activities or visits are absolutely necessary or if additional protective measures can be taken. You can visit the link here for additional information about at-risk groups. The chart here also helps us to visually understand the increased risk of being hospitalized if you get COVID and have the subsequent health conditions. So for example, a person with chronic kidney disease who contracts COVID is 4 times more likely to be hospitalized than a person without chronic kidney disease. On an individual level, this chart can be used as a guide to make informed decisions about the risk of specific activities. Be informed and know before you go. We know pumping gas is a low-risk activity and going to bars is a high-risk activity. Regardless of the rankings on this chart, there are important factors to consider for all activities, which include high numbers of people, small spaces, extended period of time, indoor gathering, frequent surface touching can all be factors that could potentially increase risk. Another thing to consider is what is the COVID literacy of the individuals you might interact with? Are the individuals compliant with safety measures such as effective face covering, etiquette, and social distancing? Less literacy could mean increased risk. Now we'll shift to discussing assessing the risk on a community level, starting with the LSU community. This first link includes a hub of information for LSU campus plans and resources. I'm going to quickly navigate to this site as well and show you where you can also be informed. You click right here, you can see the number of COVID positive cases, and that will be updated 3 times a week. So you can assess what's happening specifically in the LSU community. And this video will elaborate on changes and expectations on campus.
This fall at LSU, things will look a little different. We've worked diligently with each campus department to design an experience for the LSU community that will be as safe and healthy as possible.
Before you leave your apartment or residential hall in the morning, make sure to take a moment to complete the daily symptom checker. Next, make sure you have your mask on. Masks are required on campus and all public spaces. As you walk to your class, look for the enter and exit doors to your building. Once you are inside, stay to the right in all hallways and staircases. Follow the signs, arrows, and instructions placed throughout your building. This will help maintain the flow of people and encourage physical distancing. Each classroom has been designed with physical distancing in mind. You will see 50% of the desks and chairs removed or blocked off. Cleaning materials will be provided in the classrooms, and students and faculty will be responsible for wiping down their own desks and chairs before and after each class. If you're headed to the library after class, you can expect to see signs that encourage physical distancing as well as more space between furniture. Each guest will be required to sanitize their surfaces before and after use. LSU has added quiet zone spaces around campus for students to do virtual classes. Make sure to follow the reminders in these areas as well. When it's time to take the bus, enter from the front and exit from the back. Maximum occupancy will be limited, so adjust your schedule to allow for delays. If a bus passes you by, it is at capacity or it needs to be cleaned. Don't forget to use a Translock app to track buses and check routes. When you enter the student union, you will notice that the furniture is arranged to promote physical distancing, and you will see reminders on the floors and walls as you make your way through the building. In the dining areas, don't forget to visit the hand sanitizing station as you enter and maintain physical distancing as you go through the lines. There will be no self-serve options. All food will be served by LSU dining employees. To-go options have also been added to the menu. If you're headed to the UREC, make sure you wipe down your equipment before and after you use it, practice physical distancing, and sanitize your hands. If the fitness area is already at max occupancy, you may be asked to wait. Be sure to check out the UREC website for the most up-to-date information. Thank you for joining us on this tour, and we look forward to seeing you this fall. For more information, you can visit www.lsu.edu/roadmap.
Now we will review a few resources that extend beyond the LSU campus community. The Louisiana Department of Health has a dashboard which is updated daily to reflect specifically what's happening in Louisiana. We're going to go ahead and navigate to that site because I'd like to point out a few things there for you as well. So I'm going to scroll down and select the COVID section and give this dashboard a second to upload. I'm going to scroll down a little bit further. As I mentioned, it's updated daily by noon except on Saturdays. So just wanted to point that out. There are a lot of numbers here. You can see total cases, total deaths, total tests are all numbers that are going to increase on a regular basis. It's a running tally. I personally like to focus on the COVID patients in hospitals. So at the date of this recording, which is September 1st, 2020, there are 910 patients with COVID in the state of Louisiana. You can scroll down and click on these arrows to see a lot of other data, which I'm not going to elaborate on each section, but there were a couple of sections that I wanted to talk a little bit more about. So percent positivity or positivity rate is how many of the individuals tested are actually infected with COVID-19. One of the markers of the federal guidelines to enter phase 3, we are currently in phase 2, is to have percent positivity less than or equal to 10% for a period of at least 14 days. So this yellow line up here is the amount of test, and then the bars down here indicate the percent positivity rates, and then the gray line here indicates that 10% marker. So you can see that trend is going down on that percent positivity. The last data point here from August 26 has the state of Louisiana at 7.8% positivity. So I'd love to see that trend continue to go down. And another graph that I find particularly helpful is this one, which helps us see the amount of hospitalized patients with COVID in the state of Louisiana. and that's the green line, and the yellow line is COVID patients in hospitals that are on ventilators. And what's particularly interesting is to look at the dotted lines. So you can see at a certain point in April during the stay-home order, it trended down and we entered phase 1, and that hospitalization of COVID patients continued to decline. And about 2 weeks into phase 2, it started to increase again. And about 2 weeks after the mask mandate, you can see it has started to decline. So I'd love to see that continue to go down. We still have some work to do there, but that is some helpful information that I find on this site. This other resource here provides visuals that enable us to gauge the severity of COVID in specific areas in the US, but also across the world. So give that a second to load, but you can see there are different risk levels, and you can hover over those colors to get the exact definition. But obviously green is the lowest level of risk and red is the highest level of risk. And you can also click on the worldwide view to see what's happening across the globe in terms of COVID risk. The LSU community is a powerful one and can make a difference through actions that could help limit the spread of COVID. Bottom line, as an LSU Tiger and responsible human, we must all do our part. Now we have some inspirational words from Dr. Catherine O'Neill about doing our part.
I think that roadmaps are awesome. Just like pandemic plans, roadmaps give you the basics to control a pandemic. Everybody has a mask, everybody distances, everybody contact traces, everybody does their part. I think the difficult thing is that you could put it on paper. How do you get the student body to adopt this? And it's all a will, right? Do you want to be part of this campus? Do you want to be a Tiger who can do this? And so that's why when I look at the roadmap, I see a great plan, but the execution is all up to the student. And I think they can do it. I know they can, right? But what motivates you? Find your bubble of people on campus, just like your family has been a bubble prior to coming to school, and coexist with them. Talk about responsibility within your bubble. Everybody starting school right now, it may be difficult, but I will tell you that for the next 50 years of their lives, they will talk about how they started their college experience during a global pandemic. It's a life-defining change. And do you want to tell that story the right way, right? That you dug in and that you made it work? Or do you want to tell the story of how we did this for 5 years and you missed your college experience? It's up to us.
We can take care of ourselves by setting healthy boundaries and limitations. If you need to remind someone to wear a face covering or to keep 6 feet of distance, here are a few examples. It can be difficult and awkward to address these issues with others, whether we know them or not, but asking kindly and with a smile will often yield the best outcome and avoid a defensive attitude. If you're experiencing discomfort in this type of situation and can't bring yourself to say or do something, go ahead and ask someone for help. We recognize that mental health is important all the time, but this pandemic can put a strain on anyone and everyone. You are not alone. Here are a few resources if you or someone you know might be struggling. Additional websites are listed here for LSU's EOC, Louisiana Department of Health, CDC, and Student Health Center. Students have access to free flu shots on campus, October 12th through 15th at various locations and times. Please check the Student Health Center website and/or our social media accounts for most up-to-date info about flu shots. For any questions, please call or email Wellness and Health Promotion at the Student Health Center. Thanks for listening, and remember, Tigers do their part.